You know, just looking at this board, I know this is going to matter to a lot of you watching at home. Hello, everybody. I am Wendy Bell. I am joined by the one and only Alexandra Hessam. She is the certified nurse practitioner here at Advanced Integrative Medical 360. As such, she has to have a really deep and broad knowledge of so many issues. But to have you with women dealing with so much of what you see is pivotal. And today we're talking about birth control. It's been a long time for me since this was something that I ever spoke about, and I don't have daughters. So this is something that I know really strikes a nerve with a lot of people, because it sounds like it's almost overprescribed.
It is.
And at young ages. What do you think?
It is overprescribed. And I just have to start this whole segment by saying, if you are on birth control, I am by no means saying that you should stop taking your birth control immediately. There is a point behind this presentation, and we'll get to that. So, birth control, is it being overprescribed? Why birth control? So the number one reason up there is to prevent pregnancy, right? Most of the time that's why we're taking it, because we're trying to prevent getting pregnant, unnecessary pregnancies that we do not want. But there are other reasons why birth control has kind of come down the line a little bit more and has been used for more reasons. So acne is one of those, okay? That gets a little bit confusing though. While it makes sense that you take birth control, and there's data and literature out there that suggests that it does help to lower testosterone levels as well, but the point is that when you're prescribing birth control for some of these reasons, you're covering up the underlying reason. So even if that person's testosterone is elevated, well, why is it? Why are you just going to cover it up with taking birth control if the person really doesn't care about being on birth control to begin with? And there's a lot of, there's great benefits to birth control, but there's negatives too. You know, birth control is synthetic form of hormones. They're not identical to the hormones that your body naturally produces, and they in fact suppress your body's ability to naturally produce your own hormones. So other reasons, decrease menstrual pain. So a lot of young girls or women my age or older are still having menstrual cycles, have a lot of pain. Some women will have a lot of excess bleeding, which kind of ties into the iron deficiency anemia, which even though they're very closely related, two different reasons that people might hear of why they would be prescribed birth control. So if you're bleeding a lot, you can become iron deficient anemic. Birth control, regulate periods. Patients will be put on birth control just to regulate their periods. Maybe they're getting them too frequently, or maybe they're going longer periods of time without them, or they're skipping them or dropping them. You're trying to regulate it. Mood swings. I have terrible PMS symptoms, right? I have headaches. I am so moody. I'm so irritable. I can't stand myself.
Give me something.
Nobody can stand me. So we try to give birth control to see if we can regulate things and calm down PMS symptoms. Preventing ovarian cysts. Treating endometriosis, that's another reason. And then hair growth, which kind of goes in with acne, because acne and unwanted hair growth in places of the body where women do not want it can be related to elevated testosterone levels. So those are some very common reasons that I know of, and that I've had patients come in and say, hey, well, I say, why are you on birth control? And they say, well, this is why, I have terrible endometriosis. So that being said, we'll kind of transition into types of birth controls. So combination pills. So combination pills are a combination of estrogen and progesterone. So what happens is basically the mechanism there with combination birth control pills is that it prevents women from ovulating. So if you are not ovulating, you're not producing an egg, and so if there's no egg to fertilize, guess what? You don't get pregnant. You don't get pregnant. So then progestin-only pills are the next option, and those are two really common ones. Progestin is just the synthetic form of progesterone. So progestin-only pills are interesting because it's not that of course, some women will not ovulate on progestin-only pills, but some women will ovulate on progestin-only pills. So then that seems a little bit confusing, because you're like, well, how does that prevent pregnancy? Well, there are a couple of other mechanisms that go into play with progestin-only pills that it's thought to be the combination of those things that prevent you from getting pregnant. And it works because it has a very high, I think 99%, of patients with success rate. So the other mechanisms that happen are progestin-only pills cause the cervix to thicken, and it sounds gross, but become very mucousy, which makes it very difficult for sperm to pass through the cervix into the uterus. Another part of that is not only will some patients not ovulate, but the cervix thickening and becoming more mucousy. Progestin makes the uterus very unfavorable environment for implantation. So you know that if you have an egg that is fertilized, that's only half the battle, because now it has to implant, or it has to attach to the uterine lining. And if it can't do that, it doesn't happen. Pregnancy doesn't happen, right? So those are very common. Intrauterine devices, those have become a lot more common. IUDs is the other name for that. So like your Kyleena, your Mirena, some of them are hormonal, some of them are non-hormonal. There's a copper IUD and it's non-hormonal. Implants are another one, becoming a little bit more popular. The Nexplanon is the newest one. I think the old one was called the Implanon, but the Nexplanon, it's I know.
I didn't know what this one was, let alone last one, so I'm like, okay.
You learned something today.
Okay. Yes, that's why I come here.
It's just it's a small flexible metal rod, they call it, that they implant under the skin in the upper arm here, and it gives off small amounts of hormones and prevents pregnancy.
Huh.
Skin patches, vaginal ring like the Nuva ring, it's insertable, and then injections, which have been around for a while as well, like your Depo, which is a progestin type of injectable birth control method. So all very effective, when used properly.
So what you're saying is, when people come into Advanced Integrative Medical 360, your female patients, and you talk about this thing, when you're talking about birth control, you're finding they've been prescribed birth control for a variety of different reasons, and they've been prescribed a variety of different kinds of birth control.
Well, if this one didn't work, then we tried this one, and if you're not planning on getting pregnant anytime soon, let's just put the IUD in. That's a huge part of it,
right?
Yep.
The effects.
The long-term side effects of it. So I actually think that there's a lot that we don't know about long-term side effects about it, because we focus on how it prevents pregnancy and how sometimes it does help with some of these things. I'm not discrediting birth control in terms of some of these things, because it does help regulate periods. They are, but I can't tell you how many times I've also had young girls, middle-aged girls, older women gearing up for menopause that are still on birth control pills for different issues they've had all their lives, and they've been on a multitude of different types of birth controls, and nothing ever seems to work. So what is it? What is that underlying cause? You're just taking all this stuff. So it's important, because the long-term side effects can be the following. You can have elevated blood pressure issues, can put you at risk for blood clots, put you at risk for stroke. Those are big long-term issues the longer they're taking something. Decreased bone density can be associated with that. Weight gain, melasma, which if you've ever had, and is terrible, because I had it when I was on birth control, and it didn't come till probably 12 years after I had been on birth control. All of a sudden, one summer I was out in the sun and I had a mustache. And like a mask around my eyes. It's just this hyperpigmentation, this dark discoloration on your face, and it's terrible.
That's the last thing a young lady needs.
It's terrible. It's awful. And then it also can put you, there is data out there that suggests that it can put you at an increased risk for certain types of cancers, those being breast and cervical. But there's other data out there that suggests that on a longer term basis, it can be preventative in terms of some cancers, like ovarian and colorectal cancer. So, it's always risk versus benefit with these things. So
I think what I'm hearing here is that birth control is great when it works, right?
Yes, for sure.
But perhaps you're on the wrong one, or perhaps you just need to know what your body needs.
Yes.
And how do you find that out?
Yes. You get your blood work done.
You get your blood work done.
You get your blood work done, because it's a guessing game a lot of times.
Hello.
This one didn't work. Well, let's try a different one. They don't know what exactly is going on. And again, I've been guilty of this in the past. And I read an article by an OBGYN a couple of months ago that I loved, and kind of fits in with this segment. So she said that she was getting away from prescribing birth control to women. And she said her whole argument was that, like I previously stated, that you think you're taking hormones when you're taking birth control, but they're synthetic forms of hormones. They are not identical in any way to the hormones that your body produces. And you are suppressing down your body's own natural ability to produce those hormones, which affects all of the tissues of your body. And she said that Her analogy was, just because the key fits in the lock doesn't mean that it's going to work. And she said, then she transitioned into and said, you know, if you put diesel fuel into a car that doesn't take diesel fuel, the outcome will not be the same. Correct. It will flow into the tank just fine, but the outcome over time is not going to be the same.
It's a great analogy.
So it was a great analogy. I thought that was very, very powerful, and I think that ties into this. So we're guessing a lot of times for the reason why we're putting somebody on birth control, just trying to figure it out. It's like trial and error, and I don't think that's fair.
No,
I don't think that's fair.
And I think what I like about Advanced Integrative Medical 360 is that you are singularly unique. So your blood work, your results aren't anybody else's. And what you do and what Dr. Dubiak does is sit down kneecap to kneecap like this with you and give you a roadmap of your health and of your body. And then you come up with a plan to make things better.
Yes. We have a more concrete place to start from.
Right? I mean, who else is doing this?
Yeah.
It's so basic.
Yeah.
And yet it's so almost revolutionary in that nobody does that.
Agree.
Except you. Well, there you go, you guys. Alexandra, you know what? Your knowledge, I think, is so important to the women, but also to the men. Because if a man's partner is sideways,
100%.
the family is sideways.
100%.
Right?
Yes.
All right, do you remember the phone number? 412-227-9255. Advanced Integrative Medical 360, but she knows the website for sure.
Yeah, for sure.
IntegrativeMedical360.com. You're wonderful.
Thank you.
Thank you. And I hope your phones ring because what you're doing is important.
I
all right?
hope so.
All right. Until next time, we'll see you. Peace.
Bye.